Hey, what's up, everybody? How's it going? My name's Andrew. I am the media producer here at Catalyst Physical Therapy, and I'm here with Dr. Nathan Pavlicek. You want to introduce yourself to everybody?
Hi.
They probably know him pretty well. I'm the new guy around the block just trying to get the live and stuff going on. So, if you guys have any questions, feel free to type in the chat. We're going to ask some questions to Dr. Pavlicek and keep going. So I guess the first question I guess I want to know is like if I'm thinking of myself as a patient, and I'm thinking of myself as like, thinking like I need physical therapy, what is that first like step to like getting help? Like where should I go? Who should I go to? And why should I go to them? Or what input would you say you go to originally?
Well, depends on what you're dealing with, right? Okay. So, like if it's an acute injury, like you fell or something,
Yeah.
or you feel like you broke something,
Yeah.
or it's like some really serious injury, of course, like go to the hospital.
Yeah.
So let's screen out any like super like dangerous stuff.
Put a little disclaimer in there.
Disclaimer. Both cameras. If you fell and broke something, go to the hospital. Or if you have like a sports injury and it's really messed up, like go see your doctor. But if it's some sort of musculoskeletal pain that just kind of came on gradually, or even if it was after lifting or running or cycling or swimming, I don't know, name all the other sports.
Yeah.
Chances are you can go to your physical therapist before you see your doctor. So I don't know if people watching know, but you can go to your physical therapist without seeing your doctor first. I think the only state right now that requires you to see your physician first is in Texas, but I think they actually changed that. So you can go see a PT first.
Yeah.
They can do the evaluation, do a really good screen, like a physical screen, and then, if you do have something more complicated going on, something that does require more medical intervention, then of course, like go see your physician. You could be referred out to a different type of provider, but that's the basic screening process. Of course, again, like if something really serious, go to your doctor immediately, go to your physician immediately. But for a lot of musculoskeletal issues, and lots of other things, there's lots of different specialties with physical therapy as well.
Yeah.
There's pelvic health, there's vestibular, there's tons of different.
So for the viewers out there that don't know you too well, what are your specialties? How can may be in pain, or maybe I just want to get stronger. Like, what makes you a different physical therapist compared to every other person out there?
Nothing. No. No. So I specialize in orthopedics. I've had my practice here for almost 2.5 years. I've been a therapist for 4 and a couple months.
Okay.
So been in orthopedics the entire time. I'm also a strength coach. So my whole perspective is people can come in at 2 different points, right? They might come in because they have pain or they can't do some activity that they want to do. And so that would be the rehab side of things. And then people can also come in as a personal training client or strength training client as well. And I see it as a continuum. So I think you were in here last week and you were like, oh, like that person was rehab and that person was strength training?
Yeah.
It looked the same.
Yeah.
So it does look the same. It's just there's usually higher intensity and less restrictions on the personal training, strength training side of things.
Yeah.
Whereas if we're going through a rehab process, usually it's a lot lighter weight, it's less intensity,
Yeah.
it's just usually an easier workout all around.
Okay.
So that's my specialty for people who are in pain, particularly back pain and other issues. But about 80% of people that I see have some sort of back issue. And the goal is to get them back to doing their favorite activities, whether that is running, lifting, jumping, hiking, walking, or even just like being able to get on the floor.
Yeah.
So I work with a large range of people.
Yeah.
All different.
Let's talk about that majority range, like 80%, like, like low back pain. Let's say like somebody here is watching, like just in their bed and they just can't get up, and they're just like, they're comfortable, they just woke up, but they're like watching this and they're like, what can I do? Like, what can I do? Like, what can they do? They're in bed with some pain. What's something that they should do to help get pain free, or at least get out of bed?
Well, first, thank you for watching. First thing in the morning, I appreciate that. Hope you have some coffee and you're chilling with that. First thing is, how did it happen, right? I always will take a really detailed history with people to figure out, like, is this just random? Did you literally just wake up with it? Did you do something yesterday that caused it?
Yeah.
Is there some particular movement that might have caused it, or is it random, right?
Yeah.
Is this an acute issue, meaning did it just happen over the course of the past week, or is it more chronic, it's been going on for 3 to 6 months,
Yeah.
or longer, right? Like some people 2 years, 10 years, right?
Yeah.
So that matters. And ultimately, you have to find what works for you. So if somebody's literally laying in bed right now, like, I don't think I can get up. In the first couple days, you can take it a little easy if you're having like a back spasm and it's really grabbing. The reason I can't give a super specific answer to that is because it can be so different for everyone, right? Like some people can have a crazy spasm in their back, some can have symptoms that's not a spasm, it goes down the entire leg.
Yeah.
There's a lot of different.
What's something generic that like everybody can do that's not requiring a lot of like maybe movement, or not requiring a lot of like tools, exercise equipment, just something that requires you to move in general? What would you like kind of say to that? Like, what's something that everybody can do? Sorry about that. That was a weird noise outside. Nah, sure, that was a weird horn.
I've been here for 2 years. I've never heard that sound. I pulled it on what that was. Oh, was that like a foghorn?
Yeah, it seemed like a really old ambulance. I don't know. I thought it was the baby bass at first.
I did too. Sometimes they'll do the horn thing.
Yeah.
But that's usually 6 p.m. It's like 9:25.
Yeah.
Something.
Yeah. So anything.
Something bigger.
Yeah, something. So what's something that everybody can do that, like, somebody's having some back pain, they can't get out of bed, they're having troubles. What's something that they can do right now, today, to just improve their
Okay. First steps, without having to do any thinking: eat ice, medication. This is not medical advice. I can't tell you. But if you're cleared by your physician, anti-inflammatory medication can be helpful in some cases. So just FYI, if you're cleared to do that and it's safe for you, cool. Just make sure that if you're using a heat pad, that you're not like lying on it for an hour and not checking it, particularly if you have sensory issues. But like, what do you think the biggest reason is people burn themselves? What do you think?
Sleeping on a heat pack for too long.
Staying on heat pad too long. I think it's the number one claim, or the number one reason why therapy clinics get sued actually.
Yeah. Same thing with those electrodes. I know some patients out there probably have those homemade like electrodes they put on them, and then like my grandpa told me this the other day. He falls asleep with that on. I'm like, Grandpa, you can't be doing that. You're gonna burn yourself. Take it off.
Yeah. So the electrodes are probably fine, but
at least the heat needs
to be taken, especially if it's like an electric heating pad that's gonna stay hot.
Yeah.
Right. Like some of these other heating pads will actually cool down over time. So
yeah.
Just want to make sure that you have enough layers between it. Yeah. So that would be the first couple of things, right? To see if you can calm the symptoms down from like an 8 or from like a 9 to a 5.
Okay.
The next step would be to find a couple movements that you can do. So oftentimes a lot of people, like probably half the population will be able to walk.
Okay.
Half the population will not be able to walk.
Okay.
Right? So for the half that can walk, and I think everybody should try it.
Yeah.
Try going out, going for a little walk, even if it hurts. Not like super severe pain, but if it's like manageable.
Okay.
Try it out, see how it feels. Oftentimes people will feel really good with that. Now, for people who don't feel good with that, it feels terrible.
Yeah.
Then there are some other basic movements that they can try, like child's pose, cobra. So like these are different yoga type poses.
Okay.
So those are really the main things. I have other videos of how to do those exercises, so you can just search that on my channel too.
Like that.
Yeah.
Well, so after, let's say they do couple stretches and they get rid of their pain free, how do they maintain this over time? Because not everybody may have access to a physical therapy clinic. Maybe not everybody has access to certain materials or gym equipment. What would you recommend for those type of people who like want to continue getting better, but let's say they can't come here? Like, what's something that you offer that can also help them?
Yeah. Well, first of all, I don't think that like if you have a back spasm or like symptoms going down the leg, like pain free within one day is probably not going to happen.
Yeah.
For some people it will, right? For others, like the average course of back pain for any type is 3 to 6 weeks, 2 to 6 weeks, depending on what you do. But there is a recurrence rate that happens too. So there's a certain percentage of people who will have another instance of it later on in the year.
Yeah.
So I just wanted to talk about that point. That not everybody is going to be pain-free right away, especially for people listening who have pain for a long time. Pain-free is not necessary. I understand why a lot of people have that as a goal.
Yeah.
But getting back to life, reducing the pain, right? Because if it's like an 8 out of 10 all the time, then that's not tolerable, right? It's a little. But if you can get it down to a 2, 3, or even a 4, it's tolerable. Like you can live your life and enjoy your life. But a 0 out of 10, I don't think that's realistic for anybody to strive for at all times. Like we're all going to experience some amount of pain over our life. Now, again, like something out of 8 out of 10, you want to get that down because that's important. Like, you can't function at 8 out of 10 pain. It's too much. So, correct.
No, it's good. I think it's very good to talk about pain free. I mean, I don't want like you should be able to offer certain things. So I guess my question was like, for those people out there who can't afford physical therapy and who can't afford to like go to a personalized like physical therapist to get help or the treatment they need, you offer any services or any like online stuff that the users watching now? I know there's a lot of free stuff on YouTube. Do you offer anything else besides that?
This is the online service. So we're also going to be doing down the road where I don't know, maybe I'll wear a body cam, maybe I'll wear like a GoPro on my head. I don't know, but I'm going to go through full sessions in portions of the treatment program where with like real clients, so that people can see exactly what I'm doing, and they can maybe like replicate it house.
Yeah.
And see how they feel.
Basically, you're getting a little preview of what's to come, and basically giving them a free show to know what we're talking about later.
Exactly, because I think, it's, you can go to, I haven't seen a lot of therapists who like do their entire session with show.
Yeah.
Because I think about it like, man, I'm going to get called out on a lot of stuff, but I'm not like, maybe I like say something that's inaccurate, maybe, I say something that's not kind, and I can get called on it. So, I want to put myself out there because that's going to help me grow as a therapist. And then it can also show how different therapists treat different conditions. And hopefully that can help you, the viewer, know, like, oh, okay, so this is how he does it. I can compare that to how, like, my therapist is working with me right now and see, like, which approach is better, and maybe even ask questions of the therapist I'm working with, or chiropractor, or osteopathic physician. Like, you can just kind of use that as another vantage point, another data point, as opposed to, like, because a lot of people go to one therapist and they'll think, like, oh, that's all therapy is.
Yeah.
Just core exercises, using light little bands, and doing 3 sets of 10.
Yeah.
Nothing wrong with 3 sets of 10, but it needs to be a sufficient intensity. Like, intensity is more important than just 3 sets of 10.
Yeah. Let's recap a little bit. It's like, because some users come in a little bit late, so if you're coming in a little bit late, we're just talking about how to kind of manage like pain, manage kind of back pain, low back pain, offering services for physical therapy, kind of keeping you in knowledge on what to know. So we're gonna recap a little bit for those users coming in late or just hop in. What would you say is the most fundamental aspect of, I guess, kind of like this talk? Like, what would you want these users watching right now that may or may not be in pain or may or may not want to get better at physical therapy, get stronger? What is this main takeaway message on how they should kind of continue living their lives? What would you kind of give them some advice for?
Main takeaway is keep moving. Figure out what works for you for pain relief, and that's going to be different for every person. So you have to test a lot of things. Sometimes that's medication. Sometimes that's heat. Sometimes that's ice. Sometimes it's a hot tub. Sometimes it's playing Dungeons and Dragons with your friends. Like, honestly.
Yeah.
Sometimes it's just going out and having fun. Sometimes it's lifting, right? So there's a lot of different ways to get pain relief and also to enjoy your life at the same time. So I think a lot of people just think, especially when they go to physical therapy and ask me, like, oh, so you're just like, oh, we're just going to do an exercise. Like, well, yeah, like movement is a component of it. I think everyone can benefit from improving their fitness levels. Like, there's lots of data for that: muscle mass, bone density, cardiovascular function, brain function. Like, there's a lot. Like, your cholesterol level, blood pressure. Like, keep naming things off the list. But exercise is not necessarily the cure-all for somebody who's having a lot of pain. It's an important component, but it's not everything. So we talk about mindset a lot here too, in terms of what are your beliefs around pain, because sometimes those can be a barrier to improvement. If you believe that your body is fragile and broken and inherently just not stable, you're gonna be worried about damaging yourself. You're gonna be worried about making things worse, and that's your worldview.
There's a lot of people out there that relate to that.
A lot of people relate to that. And, that's the worldview. It's really hard to recover. It's really hard to get past it. It's really hard to start living your life.
Yeah.
So what I do with people who have that worldview is we start to test that worldview and see if it's actually true or not. And my favorite part of this job is when people change that worldview and start to believe that their body is strong, adaptable, and resilient. Because it is.
Yeah.
But sometimes we have to test it, and we have to practice it to actually believe that.
Yeah.
So the best way to start doing that is to find movements that you can do that surprise you. You're like, oh, I didn't even know that I could do that.
Yeah.
And then you track your progress over time, like, oh, dang, that's crazy.
Yeah.
I'll give you an example. I have somebody I do, she's in my Facebook group.
Okay.
And she'd be fine with sharing her name. Her name's Lisa. And
you should tell me a little bit about your Facebook group.
yeah.
I know about it.
Sure. I have a Facebook group. about helping you find back to relief and get back to living your life. We have 2,400 people in it right now, and our goal is to get as many people in there as possible, 10,000, 20,000, 50,000. It's a fun group, very positive and encouraging, and overall it's a very supportive community. So please, you can get a link, you can check the link in the description below to get that. But yeah, anyways, so Lisa, I've been also writing some workout programming for her over the past like 6 months, and she's had chronic back issues, chronic neck issues. She's actually had multiple surgeries on her neck.
Yeah.
And before all the surgeries, she was actually lifting, like pretty heavy and like going to the gym and doing all that stuff and was pretty fit. But after all this stuff, in the past couple of years, she just hasn't been able to be active. She hasn't been able to lift. Her knees were killing her, so she was never able to really get on her hands and knees. And she has the, like, her mindset is so awesome because she still has pain, still difficult. She has other health conditions she's dealing with.
Yeah.
But she decided that, okay, I'm going to have pain, I'm going to work out anyways, and I'm going to see if I can improve my condition. And so now she's working out several times a week.
Wow.
At first, she couldn't kneel on the ground because her knees felt like just shards of glass were like going into them.
Yeah.
And I think she started with like 2 pillows, putting them under her knees to like do some push-ups on her knees. And she sent me a video not too long ago where I think she can kneel to either directly on the ground or with like a very thin yoga mat now, with like very minimal pain in her knees.
Wow.
So she's effectively desensitized that area, which is super cool. And she's like doing full range of motion push-ups.
That's awesome.
Yeah. I'm gonna see if she can do like full push-ups on her toes. But like, it's possible to make improvements. It's possible to reduce or control the amount of pain that one experiences. But it's often a combination of factors. So it's not just exercise. You have to also focus on your mental health.
Yeah.
You have to focus on the medications, right? Some people do have to take medications. By the way, taking medications is not like a failure. I know a lot of people want to just get off all their meds, and if that's really a desire of yours, great. Like, you should work with your physician on slowly decreasing it while increasing your activity levels. Sometimes it's going to be possible. Other times it's not. Other times you're going to have to take medication. But if that's truly a desire of yours, you should definitely chat with your physician about that and try to titrate down as much as possible. And then, just finding other things that work: hot tub, hot pack, ice, CBD cream, like a lot of people like that.
Oh yeah.
So I think that's the biggest takeaway. If you find what works for you, stick with it. It takes a long time. See what you're like. You have a mindset that is not helping you, right? It's just completely negative. And I'm not saying that you have to be overly optimistic and it's going to go away tomorrow. I actually don't think that people should necessarily believe that.
Yeah.
Those are the people that have the hardest time. Like, oh, it'll be gone tomorrow. It's like, I was listening to a podcast yesterday, and they were talking about, I think it was in Vietnam, these two, they were talking about these two different types of people in Vietnam. Like the people who made it back without severe mental health issues, and the people who just didn't make it.
Yeah.
And the biggest difference was mindset. So the people, you would think that the people who were the optimists, who said, oh, we'll be out, these were prisoners, like prisoners of war.
Yeah.
Like, oh, the people that were optimistic say, oh, we'll get out by Christmas, or we'll get out by Thanksgiving, we'll get out by 6 months from now. Those people like did worse because they kept thinking that, oh, it's going to go away eventually, oh, it's going to go away eventually, oh, it's going to go away eventually. And they said it never did, right? Whereas the person who was just a realist was like, we may never get out of here, and I'm just going to accept that. I'm going to live my life. Those people ended up just hardening themselves in the sense of they were able to make it through because they didn't expect it to end. They just accepted their new reality for what it was at the moment. And I think there's some truth, this is an anecdote, right? It's not like a scientific study, but I think there is some truth to that at some point we have to accept our reality and accept that, it may, you're hoping that it ends, right? And I think that that's fine, but you don't know when that's going to happen. You're just going to keep working, putting the work in, and see what happens. I think that is the secret sauce. And it's not easy. Right? There are definitely days where it's going to be really hard. Probably weeks where it's going to be hard. You're like, oh, terrible. But if you have these strategies, if you have some support system, and you have just fun things that you can do, just living your life, it can make it a lot more tolerable. But not just tolerable, because who wants to live a tolerable life, but where you're actually thriving. So that's the main takeaway. There are ways to make sure that you're thriving, but it does take some work, and it's not just exercise. So that's a component, but it's not everything.
That's good. I think a lot of the viewers out there that can be watching this, like, I think they're going to be very beneficial. I think they're going to think this talk is very beneficial because based off, there's things I think they can do at home. There's not necessarily things where they have to go out, like that example you give. Like, you don't have to go out and go buy these expensive things or go buy a pair of running shoes to go running. Like, you literally just walk around your block and put some eyes and some feet, and that's a good starting point. And once you get that starting point, then you can kind of maybe start looking at some of your other videos and then start doing some exercises, or maybe sign up for one of the online programs you're signing. You're saying, I'm not sure if any of you know about that. Maybe if you want to tell them a little bit more about that.
Sure. So we have an online program. It's a 12-week back pain relief program, and it's all online. You get a customized workout program. There's mindset training that goes with it. And more importantly, there's a path to pain relief, which is really important. And the whole goal of this is to take you from where you're at today, which is probably really frustrated, struggling with just not being able to do the things that you want to do, and getting you to a point where you are thriving, you're back to whatever your favorite activity is, being with your friends and family, whether it's driving for an hour, going down to Disneyland, or going up to the mountains, or going to the beach, or fishing on your boat, or going for a run, or playing with your kids. That's what that program is for. So you can have a program for that. And if you want to know more about that, you can either send me a message, join our Facebook group, and send me a message, post in there. We'll also have a link in the description too.
And feel free to go down in the comments below, write any questions that you guys would like for us to talk about next, and we'll make sure to answer those. Okay, well, I think that is it. Do you have anything else for the viewers?
No, just get after it.
Okay,
See you next time.
That is it. Stay healthy. Bye, guys.
See ya.